Knee arthritis is an extremely common diagnosis, and it can cause such severe pain that it limits mobility and reduces quality of life. Millions of patients each year get knee replacement surgery to treat this disease and get their lives back. But what if I told you that you may be able to treat knee arthritis successfully without surgery? There are actually many non-surgical treatments that have repeatedly been shown to help patients with knee arthritis. While of course there's no guarantee that these treatments will work every single time and for every single patient, I'm going to share with you 5 of the best proven ways to treat knee arthritis without surgery and hopefully spare you from going under the knife. If we haven't met before, I'm Dr. Bounajem, and I'm a board-certified orthopedic surgeon. I completed a hip and knee replacement fellowship at Harvard Medical School after residency, and I speak with dozens of patients every week about their arthritis problems. There's no doubt about it. Arthritis can be a very challenging problem to treat. Soon after posting this video, I'll also post a more in-depth look into what arthritis is, and I'll put a link to it on the screen. In short, osteoarthritis is the most common form of knee arthritis, and it leads to loss of cartilage over time. For the purposes of this video, I'll refer to osteoarthritis as just arthritis to keep it a little shorter, although to be accurate, there are other kinds of arthritis as well. Unfortunately, when cartilage is lost over large areas of the joint, there's no way to restore the cartilage and reverse the damage to the knee. Knee replacement is often performed in these cases. But here's the truth. Surgery is not always necessary. If you're able to stay active and control the pain even if you have arthritis, you generally don't need surgery. The best non-surgical treatments for arthritis aim to minimize the symptoms and slow the progression of arthritis rather than reverse the changes that have already occurred. We can break down these 5 treatments into 2 categories. The first category includes physical strategies. Let me explain. Knee arthritis causes pain because loss of cartilage leads to higher stresses and greater friction in the knee joint, both of which are related to the forces placed on the knee, such as gravity. That's why arthritis pain often improves with rest. But if we can reduce the stresses placed on the knee overall, the inflammation and pain can improve. And since this stress is a physical concept, we can use other physical concepts to improve the pain. The first physical strategy is exercise. Exercise is, of course, a very broad category because many different activities qualify as exercise, but here's the good news. Studies have shown that multiple different kinds of exercise can help improve pain from knee arthritis. Exercise is thought to improve the pain in many ways, including by strengthening the muscles around the knee to help improve support to the joint, improving flexibility, facilitating weight loss, and even by increasing the release of endorphins, which are naturally occurring chemicals in the body that help improve mood and reduce pain. Have you ever felt really good after doing a lot of running, which is often called a runner's high? Yeah, me neither, but apparently some people do. That feeling is caused by endorphins that are released during exercise, which help improve mood and reduce the sensation of pain. I'm a big fan of supervised physical therapy, especially for my patients who don't have a background in exercise, but frankly even for those who do. A strength-focused approach helps build the muscles around the knee, which function like shock absorbers that help reduce the stress on the worn-out bone and cartilage. So yes, while exercise does put a temporary increase in stress on the knees, the muscle-building effect of exercise over time helps reduce the chronic stress placed on the knee during daily activities and therefore helps reduce pain. Bear in mind that even carefully performed exercise can exacerbate the arthritis, especially if the arthritis is severe. So a gradual approach should be taken to make sure that you're helping rather than hurting the problem. Exercise can be extremely effective, but sometimes the arthritis is so advanced that the knee can still feel unstable. The next physical strategy, the use of a brace, can help improve that. Braces are available off the shelf, but can also be custom made. They can help stabilize the knee joint and reduce excessive or abnormal movement within the joint that normally causes pain. Some braces called unloader braces help to unload the pressure from one area of the knee by correcting the alignment of the knee. Braces can also improve the proprioception of the knee, meaning they help improve your awareness of the position of the knee and where it is in space, and this helps to improve balance and control of the joint. Some downsides of braces are that they can be bulky and cumbersome to put on and take off, and depending on the shape of your leg, some braces may just not fit very well. Custom braces can help alleviate this issue by shaping the brace to your own anatomy. Just be aware that if braces are used excessively, they can reduce the need for the muscles in your leg to work as hard, and this can lead to the muscles getting smaller and weaker over time. If needed, braces are probably best used intermittently, especially during longer or more strenuous periods of activity. It's reasonable to start with a flexible knee sleeve like what we see here, since they aren't so supportive that the muscles can just take the day off. If needed, more supportive braces can be used. Just keep in mind that the more supportive a brace is, the less of a reason the muscles have to stick around. Of course, braces have to be worn in order to be helpful, and most people would understandably like treatment options that don't have to be carried around or strapped to your leg in order to work. Rather than adding something like a brace to your body, sometimes subtracting from your body can be even more effective. That brings us to our last physical strategy: weight loss. For patients who are overweight, weight loss can be powerful. Excess body weight not only contributes to the formation of arthritis, it also chronically exacerbates the existing arthritis. Now, here's the part that many people don't know about. Because of the laws of physics, your knees actually experience multiple times your body weight in force during physical activity. For example, during walking, your knees experience somewhere between 1.5 to 4 times your body weight. Getting up from a chair, walking on stairs, and squatting down can put stress on your knees equal to 4 to 7 times your body weight. This seems like a huge negative, but you can actually turn it to your advantage. How? Because the reverse is also true. For every pound you lose off the scale, you're taking 7 pounds off your knees during some of these activities. That is an incredibly efficient way to reduce stress on your knees, which can lead to massive reductions in inflammation and pain. Of course, if weight loss was so easy, then everybody would be doing it. If you're overweight, I recommend talking to your primary care provider and discussing a possible referral to a weight loss specialist to help guide you through this process. In my experience, many people can lose weight, but the challenge is keeping it off. Some of the most successful weight loss efforts that I've seen have involved small incremental changes in diet and physical activity over time, rather than massive changes all at once that are more likely to fail. Lastly, I just want to emphasize that weight loss should be used for patients who are overweight to begin with. If you are already at roughly an ideal weight, or certainly if you're underweight, I strongly recommend against weight loss unless it's specifically recommended to you by a healthcare provider, because this can be detrimental to your health in other ways. So we've covered the main physical strategies for treating knee arthritis without surgery. The other category is pharmaceutical strategies. Rather than reduce the stress on the knee like physical strategies, pharmaceutical strategies target the inflammation and pain directly. The first of these pharmaceutical strategies is the easiest to implement, and that is medications like acetaminophen and nonsteroidal anti-inflammatories, also called NSAIDs. Acetaminophen is more commonly known by its brand name Tylenol, and it's both an antipyretic and analgesic, meaning it helps to reduce fever and improve pain. Since it's not an anti-inflammatory, it's often a reasonable option for patients who are unable to take NSAIDs, such as those who have kidney problems or gastrointestinal issues. For patients who can take them though, NSAIDs like naproxen and ibuprofen can help reduce the pain even further. As the name implies, they also reduce inflammation, and both oral and topical NSAIDs have been shown to help. In general, patients with liver problems may be told not to take acetaminophen, and patients with gastrointestinal issues, kidney problems, heart disease, or high blood pressure may be told to avoid NSAIDs. It's important to talk to your healthcare providers before taking any of these medications, especially if you have doubts about their safety for you. While these medications can help, sometimes they're just not enough to improve the pain. For that reason, we often turn to our next pharmaceutical strategy: injections. There are many kinds of injections, but the most commonly used are steroid and gel injections. These injections go by many names. Steroid injections are commonly called corticosteroid or cortisone injections, and gel injections are often referred to as viscosupplementation, hyaluronic acid injections, viscoelastic injections, or rooster comb injections. Gel injections used to be made from the combs of roosters, which explains the name, but these days they're largely produced without animal sourcing. Steroid and gel injections are administered directly into the knee with a needle and syringe, but each type of injection works in different ways. Corticosteroids are powerful anti-inflammatories that reduce pain by reducing the inflammation in the knee. These are different than the steroids that bodybuilders take, which are anabolic steroids. The reason they're both called steroids is because both contain the same 4-ringed carbon molecular structure, but they work very differently. As opposed to steroid injections, gel injections are thought to work by improving the lubrication of the knee, reducing the friction between the bones. Out of all types of injections, steroid injections actually have the most amount of published evidence supporting the notion that they can actually help improve pain from knee arthritis. They're generally considered safe to use in arthritic knees as long as they're spaced out about 3 to 4 months apart from each other. Some studies show concerns about possible cartilage damage with excessive use of steroid injections, which is why it's best to space them apart. If gel injections help, they can usually be repeated at 6-month intervals. Improvement from either type of injection can last anywhere from a few days all the way up to several months, so the results are variable. A third type of injection that may also help is PRP, which stands for platelet-rich plasma. This type of injection is taken from the patient's own blood and prepared with a centrifuge, which separates out the different blood components from each other. Once it's fully prepared, it's injected directly into the knee. Platelets are the cells in the blood that help form clots, and they make several proteins called growth factors that are important in the process of wound healing. PRP injections are thought to help by stimulating a similar healing process in the knee joint. Some studies have shown that they do help improve knee pain and function, but there's no clear evidence that they actually heal the arthritis itself. There's also variability in how the injections are prepared, and the injections are typically not covered by insurance, so there are some downsides. Ultimately, while PRP injections can help some patients, more studies are needed to help guide their use overall. And there you have it. 5 of the most extensively studied methods of treating knee arthritis without surgery, encompassing both physical and pharmaceutical strategies. Again, there's of course no guarantee that these will work for each individual patient, but studies have shown that they have helped for many patients. The beauty is that these strategies can be combined, often to greater effect. For example, while weight loss and injections can each individually provide improvement, patients who combine the two often have even more improvement. Think of it this way. Each treatment strategy has a certain probability that it will work for you. By using more strategies, you're playing the odds and increasing the chance that what you're doing will actually make a difference. It's crucial to remember that you should always check with your healthcare providers before trying any of the treatment options that I discussed. Even though they've been shown to work, they are still just general guidelines and should be assessed for each patient on an individual basis. Thank you for watching this video. If you found it to be helpful, leave me a comment down below telling me what you'd like me to talk about in a future video. Stay well, and I'll see you in the next one.